And we're live. Hi, everyone. Welcome to Talking Live with Macy. It's good to see all of you after a very long CNY break. I know for many of us, the CNY break was a good one because many of you actually haven't seen your friends, your relatives in 2 years. So this was a good time to connect with them. We'll try to wait for 15 people before we begin. So right now, if you're tuning in, please share this with your friends, with your family. How do you share it? Click the share button, or you can copy and paste the link and share it with your friends on WhatsApp, on Twitter, or any other social media platforms. It looks like there are a lot of people tuning in today because we are also giving away to 5 lucky winners a free consultation with Dr. Pandian. So please stay tuned. We have achieved 15 people. So we want more people to come in because we want them to be aware about fertility. So please share this with them right now. Copy and paste the link and share it with them through WhatsApp, Twitter, Facebook, or simply share on Facebook and Instagram. All right. Okay. So welcome to Talking Live with Macy. Hi, everyone. It's good to see you. I know that the cases in Malaysia and around the world have been rising rapidly due to the Omicron wave. So please stay safe. Either you yourself, I'm sure you are either a close contact, have COVID, or you have friends who have close contact. I know that because currently I'm a close contact. So I'm safe and sound quarantining at home. That aside, today's topic is something very close to my heart. If you actually tune in to Talking Live with Macy, you would know why I've mentioned this before or have been following me. I have been married a couple of years, but I don't have children, and I love children. So the big question mark is why I myself am struggling with fertility, and that's why any topic on fertility is very close to my heart, from the awareness to the journey on fertility. So if you have friends, family who are trying to conceive or struggling, please share this with them now so they can tune in, join us, and also hopefully get a free consultation. Stay with us until after Dr. Pandian has answered all the questions, because that's when we're going to run the giveaway. All you need to do is actually ask questions. All right. And who is Dr. Pandian? This show is actually in conjunction with this first year anniversary celebration of the Pandian Round Fertility Clinic. So, congratulations, Dr. Pandian. He is
Thank you,
a
Missy.
consultant obstetrics and gynecologist, as well as a fertility specialist. So we are here today. I'm so honored to have him to join us to discuss about the secrets to boost fertility. So I'm going to jump straight to the questions while all of you are tuning in. So Dr. Pandian, hi, thank you
Hi.
for joining us and
Hi, Missy.
congratulations once
Thank
again.
you. Thank you,
Um,
and good afternoon. And
Good afternoon. So, Dr. Pandian, as a fertility specialist, what are the trends you see amongst Malaysian women nowadays, and also our fertility rate?
well, yeah, Missy, if you see the trend, uh, if you look at the last 5 or 10 years, the fertility rate, infertility rate, actually in the race, and you can say that one in six couples are infertile, and as probably we may say that they're getting married in a later age, or probably they are more occupied with their job, probably they are concentrating in their career. Once everything is settled, by the time they get married and they think about children, is they're already in their mid 30s, 34, 35. And once they start trying naturally, and by the time they start going to a fertility doctor, they are already in 36, 37, 38. So that's why, as you know, as the age increases, the chances of getting a child becomes lesser and lesser. Yeah.
All right. So, Dr. Pandian, um, we're talking about the age increase. So,
Yeah.
but I mean, like, just throw in that one question. You just can say yes or no. Stressful lifestyles also affect the fertility rate, does it, or is it a myth?
Yes, definitely.
Okay.
Yes, I would agree with you. Definitely. Yes.
All
Mm.
right. So for women, okay, we'll jump straight to the fact that for treatment options for
Yeah.
people who are experiencing fertility issues, for
Yeah.
women who need to go through IVF, what are the do's and don'ts before IVF treatment? I think a lot of women are always wondering about it. So maybe you could share that with us.
Yeah, actually, as much as you want to conceive a child, a couple must also, or couple, or everyone must understand that preparation for IVF is very, very important. Pre-IVF sessions are very, very important. You must find a good consultant, a good fertility consultant, whom you can talk to, whom you can listen to, and who is ready to spend the time to explain things in detail. So it's not
Yep.
someone who rushes things you out. And you also, as much I was telling you, as much as you want to get a child, you shouldn't rush into things to get a child. Yes, it's not like you're going to a supermarket or mall to get a baby. No, it's not. It's if you're not getting a baby naturally, that means there's something wrong. You need to find out what exactly wrong. What's wrong with your partner? What's wrong with you? So all that are very, very important. A good counseling with a fertility specialist is very, very vital. And basic investigations like sperm analysis and
Yep.
hormones in a lady, and as well as egg count. We call it anti-Mullerian hormone egg count. As the age increases in a lady, the ovarian reserve to produce eggs becomes lesser and lesser. As the quantity reduces, and the quality also becomes lesser. So you must understand that as you wait and waste your, I mean, as you wait for your child, you must remember that your ovarian reserve is getting lesser and lesser. So you must consult as soon as you decide that you want to have a child. You've been trying naturally, and you have tried IUI, and there's nothing work. Then you must go to your plan B. That's IVF. And like what you were asking me, what are they supposed to do? Well, they're supposed to meet the specialist, fertility specialist, and talk to him or her, and get a full investigation done. The What's wrong with the couple, male as well as the female partner? That's very, very important. Then prepare themselves. If and As you know, obesity is something very serious, as well as and very sensitive issue. As much as you want to have a child, and you must try to keep an optimum weight. You must do at least regular exercise, have a healthy diet, and certain things like acupuncture and supplements are very, very important to boost up your sperm quality as well as the egg quality. So once you are ready, and once all the investigations are done, then we go. Yes.
All right. So, Dr. Pandian, I think this is to address the fact that in Malaysia and also in Asia, a lot of the times when people have fertility issues, they think it's mostly the women's fault. So, I'm
Exactly.
very happy that you actually mentioned that both the male and female, it takes two to
Yes.
clap, right? By the way,
Exactly.
everyone,
Yes. Yes.
both of them need to go for assessment, not just the
Yes.
females. So,
Yes.
that's
True.
very good to hear. This coming
Yes.
from Dr. Pandian, who's a fertility specialist.
Yes.
Yeah. So, Dr. Pandian, what determines an IVF protocol and what types of protocol are there?
Well, we have two types of protocol. One is a long protocol, another one is a short protocol. Well, it's the length. Long protocol, that means
Yeah.
the lady has to inject in a longer period, and whereas a short protocol is probably 10 days of injection, and on the 12th day or 14th day we do the egg pickup, which is very much patient friendly. So most of us, the current fertility specialists, we prefer short protocol, because not only it's cheaper, and it's patient friendly, and as well as there's no difference between the success rates between long protocol and short protocol. In fact, patients are happy, and I mean, the cycles are done very fast, and within 2 weeks everything is done. So I would say short protocol is the best. Yes.
So, this is very good to note for those who are thinking of IVF.
Yeah.
So, people talk about fresh and frozen embryo transfer. What does
Yes.
that mean?
Okay, before we go to fresh or frozen embryo transfer, we should also talk about the day 3 and day 5 embryo transfer. I think probably you will ask me that soon, I guess.
So,
Yeah.
yes. So, I guess you can just two in one.
Yeah, correct. So many people, they don't many I would say that many of them, before they come to us, they really know, they already Google, read about it, and they are very well versed. So basically they come with the questions, then they ask this. But again, some of them, I would say many of them as well, they don't know what is day 3, what is day 5, what is fresh, what is frozen. So you must understand that, well, as I told you, day 3 and day 5, day 3 embryos are still, this is the uterus. I would always say this is my favorite pet. so so usually let's say ovulation occurs here, and the sperm goes here, and the fertilization occurs, and the embryo travels back. So when the embryo travels back, day 3 embryo still in the tube. It hasn't reached the uterus yet. Okay, so whereas day 5 or blastocyst is the one which reaches the uterus,
Inside.
ready to implant. So if you put a day 3 embryo, the embryo is not ready to implant yet. So it has to develop into blastocyst, then only it implants. Whereas you put a blastocyst inside, it's ready to implant. So if you ask me, some embryos are on day 3, but when we wait and we push them to day 5, like let's say you have 5 day 3 embryos. So when ultimately you push them to day 5, probably only 2 make it, the 3 don't make it. So that means the 3 embryos are not good, not healthy. So
Mm.
in case if we transfer those 3, you're going to have few failed cycles. And patient will be wondering, why did I fail? Looking at the embryo, we may say grade 1, grade 2, or excellent, or moderate, or good, but that doesn't mean anything unless you really check it. Then only you know. The appearance doesn't actually say whether the embryo is really good or not. So, in my opinion, day 5 embryo are the best embryo to be transferred. We will talk about the genetic testing later, but now we come to fresh or frozen embryo transfer. So fresh embryo transfers are once the IVF cycle is done, when egg pickup is done, then fertilization, and the embryo is formed. Well, when the embryo comes to day 3, immediately they do a fresh transfer. But most of the time, the success rate is very low compared to a frozen embryo transfer, because
Mm.
the ladies are subjected to high dose of injections, and they are not stable. I would say, in a layman's term, they are not stable enough to accept this embryo, and the ladies are not well prepared to be to do embryo transfer. So there's a lot of other things to be done before we do the embryo transfer. So the best is to send these day 3 embryos to day 5, and we freeze the embryos. Then we prepare them, the partner, to ready for the embryo transfer, that is frozen embryo transfer. So preparation is very, very important. So if you ask me, day 5 embryo plus frozen embryo transfer gives a better success rate.
Okay. Interesting to note. For those of you who are once again thinking of IVF, this is a very good thing to understand about IVF, what it is, day 3, day 5, day 7, and also fresh and frozen embryos. I know because there are many people who are always asking about questions like these. So please stay with us until I have just 3 more questions for Dr. Pandian. Then you guys can ask the questions. And we're also giving away 5 lucky winners a free consultation with Dr. Pandian because he's so kind to help people who need the consultation. So stay with us to win the free consultation with Dr. Pandian. There will be 5 lucky winners. All you need to do is ask questions. So I have 3 more questions, Dr. Pandian. So could you tell us a bit about the latest technology for IVF treatment offered at your center and how does it help the patients?
Yeah, yeah. Okay, Maisie, you must understand that we were talking about day 3 and day 5 embryos, and if you remember, I told you that day 5 embryo, frozen embryo transfer is the best. But again,
Yeah,
before we freeze these blastocysts or day 5 embryo, it's best to do a genetic testing. We call it pre-implantation genetic diagnosis, or screening.
PGS.
So why do we do this? We need to select genetically good embryo. So to increase the success rate, to decrease the failure rate, and to decrease unnecessary transfers, and also to make sure that these embryos are uh, 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 healthy, meaning that there's no Down syndrome and no other syndromic features. So we choose that. So we do a genetic testing. So you can choose. You can choose to do 1 embryo or 2 embryo, 3 embryos. So once the embryos are in day 5, then we do a genetic testing, then we freeze them. Then we wait for the results. The results will take a week or 2 or 3, depending on the centers. So while we prepare the partner for the embryo transfer, once we get the results, then at least we know these embryos are good, genetically
Mm.
healthy to be transferred. So if we don't do a genetic testing, we are not sure whether these embryos are healthy or not. So basically,
True.
even though the embryo looks excellent or good grade or A grade, so it may not be good. It may not be genetically good. And when we transfer, so unnecessarily we are wasting your money, and unnecessarily your waiting period, your anxiety, your expectations, everything goes wrong. I mean, if you get a negative results, then you'll be wondering, why did I fail? I mean, I transferred an excellent embryo, but you remember you transferred an excellent embryo, but that doesn't mean that the embryo is healthy or genetically the embryo is good. So nowadays in our center, almost all patients do genetic testing. But at times there are patients are very disappointed because on day 3 probably they have some 10 embryos. When we push it to day 5, they have probably about 3 to 5 embryos. When we do a genetic testing, everything not good. So
Nothing. Yeah.
no embryos to be transferred. Well, yes, it is sad and we are disappointed. But however, we are preventing unnecessary
Further
transfer and further
disappointment.
disappointment. So you must understand that. That's very, very important. So genetic testing has been there in the fertility field for quite some time. I'm sure many of them getting to know it. And in our center, we do almost for every patient for this genetic testing. That's very, very important. Then talking about latest thing, there are another test also we do. It's called ERA, or endometrial receptivity analysis. So what do we do on this test is on the day of transfer. That means once we have chosen this genetically good embryo, on the day of transfer, actually we don't do the transfer. What we do, we take a biopsy of the endometrial lining. Then we send it to the lab. The lab is in overseas, probably in Taiwan or Japan. So the result takes about 2 to 3 weeks for us to come back. So we cancel that cycle. So instead of 2 months, it goes to another 1 or 2 months delay before we transfer. But it tells us accurately when is the best time to be transferred. That means whether the uterus or the endometrial lining is ready to accept the embryo. So that's another thing that a lot of patients are considering now. So that also lead to a lot of success rates. Yes, and
I
unnecessary
think
failures.
I think it's definitely important to do PGS and ERA
Era.
simply
Yeah, area.
because, especially for coming from experience, I think especially for those who failed transfers and unnecessary transfers, because
Correct.
every time we do a transfer, ladies, just bear in mind you need to inject hormones into your body as well. So
Yes.
these are things that all of us have to take note of. Um, and we should try our best to actually try all these new technologies that are available to us. And you can start putting in your questions now to everyone who's tuning in. So please start asking questions to Dr. Pandian because as long as you ask a question, you may stand a chance to win a free consultation with Dr. Pandian. My second last question, Dr. Pandian, is what is generally the current success rate in IVF treatments in Malaysia and generally?
Well, I'm very glad to say that, especially in our country, Malaysia, we have a lot of very good IVF fertility specialists, and in Penang as well as in KL. So a lot of foreign patients come to us, especially patients from Indonesia, China, mainland China, and even our neighboring countries, Singapore, Thailand, because our success rates are really, really comparable. Very much. And of course every center has their own success rates. Some have very good 60 to 70, even some have 80%. So this is very much high compared to other countries, and we are proud that in our country we have very good fertility specialists, and we are doing a good job. Yeah.
That's very good to hear.
Yeah.
So rest assured, all of you, you're in good hands. Once again, I would like to tell you this is my last question. So we're waiting for questions from all of you. As long as you ask a question, you'll stand a chance to have a free consultation with Dr. Pandian. There'll be 5 lucky winners. So please start asking your questions now. I know many of you have questions, and don't be shy. This is not something to be stigmatized about, I feel. And once again, it's not just a lady's problem. So if you're a male watching this, it takes 2 hands to clap as well, to conceive a
Yeah.
child. So last but not least, Dr. Pandian, are there risk factors involved in the treatment?
Yes, very, very good question. Yes, of course. Whenever we do something, of course, there's always some risk factors. Not very high actually, but of course, and if that's why the consultation and counseling of IVF and fertility treatment is very, very important. And of course, when we start giving these high dose injections, there could be some adverse effects of the drugs. Probably sometimes, rarely we have allergic reactions, or sometimes may have this nausea, vomiting, bloating, sometimes
Mhm.
constipation. All these minor issues may come up. Then the most important issue that we worry during stimulation is ovarian hyperstimulation, especially
Okay.
PCOS patients. PCOS patients
Yeah.
where they have very high egg count. So when we stimulate, there's a lot of reactions occurs in the body, and that leads to a lot of other adverse effects in the body. So nowadays, most of us, I think almost all our fertility doctors in Malaysia, we are running a OHHS free clinic. So we advise the patients to take very uh, high protein diet. Yeah, consume
High
eggs
protein.
and protein, chicken, fish during
Wow.
the cycle, and as well as we also titrate the drugs. We are very careful whenever we treat a young, thin, lean PCO patients. So that's a very something very important that all patients, PCO patients, they need to know about this. And of course, when we do the egg pickup, it's a very minor procedure. It's not a surgery. It's a minor procedure where just a small needle goes through the vagina, and we pierce. Then we take out the eggs from the ovary. So of course there are some risks that injury to the neighboring organs and all that, but it's very much negligible, very less. In a good hands, almost nil. The complications are nil. Then, of course, it is also associated with anesthesia when we do the procedure. So
Mhm.
sometimes you may have some nausea, vomiting, or some minor issues with anesthesia. But if you ask me, all these are very minimal. So in order to not to get shocked when you get it, that's why the counseling is very important when we explain to them everything from A to Z, so they understand very well. So in fact, it's a safe procedure. It's a safe procedure, and I would. Of course, everybody wants to conceive naturally. Yes, I agree to that. But once you try it for a certain period, as your age catches up, you must think of alternative and plan wisely. That's my advice.
Yeah. So, for those who have just entered, thanks, Dr. Pandian, for answering my questions. We are now opening the floor to questions to all of you. So, start asking questions. You may stand a chance to win a free consultation with Dr. Pandian. We're choosing 5 lucky winners. Put your questions in now so there won't be a backlog of questions and we won't have to actually not answer your questions. Actually, Dr. Pandian,
Yeah,
one last question from me.
yeah.
You mentioned a lot about IVF. Is there any other treatment options available to the public if they are trying to conceive besides IVF?
Well, well, of course, natural treatment. Many of our patients, when they come to us, of course, financially they may not be ready. Financially, they may not be ready, or sometimes they are not ready yet. They are not ready to accept the fact that they want to do an IVF. So we still do a natural way of where we ask them to take some drugs during stimulation,
I see.
follicle stimulating drug from day 2 to day 6 of their period. Then we call them back on day 10 or day 12 to check whether the follicles are growing well. So once the follicles is big enough, then we give a trigger injections for them to have ovulation, and we advise them to be together during this period. Many of them have conceived this way as well. But these all the initial treatments. Then in case if they don't do well,
Right.
probably IUI, intrauterine insemination, where we collect the sperm, then we inject into the uterus, then many of them conceive as well. Then there's another thing called intravaginal insemination. So you'll be surprised to hear that many of the couples, even though they are married, they are not able to have sexual intercourse. Probably there are a lot of other issues we have seen. Even some couples married for 5 years, they are not able to have sexual intercourse. So in these patients, we do another a small procedure called intravaginal insemination, where we take the sperm and we inject into the vagina. So we have patients have conceived that way as well. So
Wow.
sometimes patients are very embarrassed or are very shy to come and tell us that they're not able to be together and all that. But you shouldn't be. You shouldn't be. I mean, you should open to your fertility specialist. Then only they can give a proper treatment. Yeah,
Yeah, I totally agree. So
yeah,
be honest, be
yeah.
and be informed so that you know what's going on with your body and what is right in a way and what's wrong with your body. So thanks a lot,
Exactly.
Dr. Pandian, for answering all my questions. Now I'm going to
Thank you.
start taking questions from the audience. So
Yeah.
our first question is from Vimala. She says, "Good afternoon. Is there a way to test a genetically good egg?" Interesting
Mm,
question.
well, interesting. Well, we don't well. Uh, I'll be glad and to check genetically good egg and genetically good sperm before we putting in. But however, we don't have that. So we normally what we do is we do genetic. We test the embryo rather than the egg. rather than the egg. Because once we put the
Oh yeah.
sperm, even though
Mm.
genetically good egg, we don't know whether the egg is
The
going to fertilize.
sperm.
When
Yeah.
the sperm, we need to put the sperm in. So then I think even though if there is a technology, such a technology, I guess it's better to test the embryo genetically rather than the egg.
Okay.
Yeah.
Yeah, I think that's true as well. Next question is from Samantha. She says, "Hi, Dr. Pandian. Will supplements help in improving the success rate when we go for IVF treatment?"
Yes, definitely. There are some doctors they don't believe in that, but I really do believe in this because whenever we subscribe a supplement, it's not that I like or somebody like or you like. No, it's all evidence based. There are evidence shows that if you take such drugs, it's going to improve. So we have vitamin D. Normally, I prescribe vitamin D about 1,000 international unit a day. It's very good to improve the quality of the egg as well as implantation of the embryo. And we also have DHEA. It's a very good drug as well. It improves the quality of the egg. Then, of course, we have other things like folic acid and omega 3 and all that.
Mm-mm. Yeah.
People can take it. Yeah. Whereas usually for guys, normally I prescribe Profotil. Profotil is a combination of
Yeah.
drugs
I've
like
heard of it.
zinc, selenium, glutathione,
Mm.
folic acid, which really improve. We have seen very good improvement by giving Profotil to guys. It's once in the morning and once in the night. So you take it for at least 3 months to 6 months, it really improves. And we have seen very good outcomes. So I do believe in supplements. I would really suggest you to take at least minimum 1 month or 3 months, depending on individual
Yeah.
basis. We need to see what's the egg count, what is the sperm analysis, and everything. Yeah.
I actually know someone who took Profitil and
Mm.
it worked for them.
Yeah.
Uh, they immediately conceived a child. That
Yeah.
was, yeah. So that's interesting to note that, even with you, you've experienced it and there is
Yeah.
very good successes.
Yes. Good.
Um, so the next question is, it seems like a lot of people want to know about food intake, supplements intake. It's every session, it seems a lot of you are interested. So keep the questions coming. Um, Angela asks, "Hi, Dr. Pandian. What kind of
I
supplements will help in women with PCOS in order to increase the chances of fertility?"
Well, okay, you must understand that a lot of things going on in online and in social media that PCOS can be treated or PCOS or PCOS can be treated. Well, PCOS is not a disease, but it is a condition that you are carrying since you are born. You must understand that nothing can treat. PCOS cannot be treated, but you can the symptoms or signs of PCOS can be treated. Mainly, irregular menses can be treated. Fertility. Actually, PCOS patients are, I would say, blessing in disguise because they have good ovarian reserve compared to other ladies. Yes, so
Wow,
I
okay.
would really happy a PCOS lady come and see me. So our most of our success rates are PCO patients where not only they conceive naturally or even with IUI and mainly with IVF. Many of our IVF patients, successful patients are PCOS patients. Well, if you ask what are the supplements to be taken, well, for me, I give vitamin D and DHEA. These are I will tell them to.
Mhm.
It's probably we are not able to sell, but probably they can get online or they can buy it from the pharmacy. So these
Pharmacy.
two drugs supplements are very very good in order to improve the quality of the eggs. And PCOS as such, there's no supplements as such to improve PCO patients to conceive. No, there's no such thing like that.
Okay.
Mm.
That's actually very interesting to note that PCOS, females with PCOS can actually conceive better through
Yes,
IVF.
yes, actually, they do very well. Yeah.
So
Mm.
interesting.
Yes.
Angela had a follow-up question.
Yeah.
She said, "Do you have Profitil for women?"
Yes, we do. We do have. It just
Oh,
launched. Yes, the company has just launched. We are about to get it as well. So instead of telling patients to buy that supplement, it think the company makes life easy for us. Okay, just take this just like Profotil, just this female Profotil. Yeah, we will be distributing in our clinic as well as I guess the distributing company will be doing it to all other fertility centers as well. So I would advise my sincere advice is for guys take Profotil, male Profotil, and for ladies, please consider taking the female Profotil. They will come up with the product soon, so it will be really helpful. Yes,
okay. Very interesting to know as well on that. So, do we
yeah.
have further questions from the audience before we close the session for today? We'll take maybe one or two last questions. If you have any questions about be it fertility, any gynecological related questions. I know today's session is more of fertility. So if you have any questions about IVF, the procedures that we've spoken about, day 3, day 5, what it entails, please ask them now. I'll give you guys like 10 seconds to type it in before we close the session. But thank you, Dr. Pandian. It has been very, very insightful and actually eye opening for a lot of the things that you mentioned today. I think everyone here who's been staying tuned throughout the session has finds it very interesting. I think
Yeah.
also another thing is like you mentioned about age, but also risk factors includes like you mentioned also obesity and what about people who have had cancer and things like that? Does it apply similarly for everyone in terms of treatment options?
Yes, yes. I would say, of course, we don't want our patients to get into such situation. But in the event they get it, I think rather than jumping and going for the cancer treatment, I think they should also discuss their plan with the fertility doctor. So what we can do is we can do IVF, and we can freeze the eggs. We can freeze the eggs, or if it's to the female partner, and if it affects the male partner, probably we can freeze the sperms. So later on, when they go for this cancer treatment, and probably they may need to take a chemotherapy or radiotherapy, which may definitely affect the ovaries
Yeah,
and the eggs, as well as the testes, as well as the sperm. So I would say, talk to your fertility doctor, get a proper treatment. If the lady do IVF, if you're married, fine, it doesn't matter. You still can do IVF and freeze your eggs. If you're married, well and good, we can still do IVF and freeze your embryos. Go for the cancer treatment, get it sorted out, everything, then you come back. Because if you don't do this, and if you're going for a cancer treatment, then of course it's going to be difficult when you come back. Your fertility will be jeopardized. So we need
I
to
see.
you need to have a combined consultation with the oncologist or the cancer doctor, as well as the fertility doctor, which is important. Then a combined consultation will be very much welcome. Yeah.
I think this should actually we should have a separate session on this because
Yes.
a lot of people in my young cancer survivors group, fertility wasn't discussed with the
Mm.
oncologist, and
Yes.
then
Yes.
he becomes an issue after. So
Yes.
this is something that we should have another session for. Anyways,
Yeah.
we'll take one last question, one or two last questions. So Vimala
Yeah.
had another question
Yeah.
on any suggestions for diminished ovarian reverse patients.
Yeah. Okay. You must understand that unlike guys, they can produce sperm every 3 days. They have the factory to produce sperm every 3 days. Whereas ladies, when you're born, even though you have your factory's ovaries, but your ovaries shuts down producing eggs when you are born. So whatever eggs that you have is going to be there until you start having menses. Your ovarian reserve becomes lesser and lesser. At 30, there's a drop. 35, there's a drop. 40, there's a major drop. So the ovarian reserve drops, the chances of you producing eggs will be very, very less. Or when we try to stimulate the ovary, it's going to be difficult as the age catches up. Well, answering to your question, we cannot improve the ovarian reserve or eggs. It is irreversible. However,
Mm.
even with the whatever ovarian reserve that you have, if you have a good preparation with good supplements, and I also wanted to talk about acupuncture. Acupuncture also really helps. Most of my patient goes for acupuncture. You may ask, why acupuncture? Acupuncture helps a lot of improve in blood flow, and it improves the implantation. It makes your reproductive organ healthy, and it very much evidence based. So you can go for acupuncture as well. So all these improves. Even you have one egg, one embryo. We have seen many patients. One egg,
Yes,
embryo. We have
it's
got that embryo
it's
transfer. Yes, they are successful with a
yeah.
very
My
very
cousin
low
was
egg
like
count.
that.
Yes, very
It's
very
amazing.
exactly. We just need to catch that one. We say golden egg,
Golden
golden
egg.
embryo. Yes, yeah. So
Yeah,
we unfortunately we can't improve the quantity or improve the ovarian reserve, but however we can improve the quality. That's very very important. So those
true.
who have, advanced age and low AMH or low ovarian reserve egg count, don't be disheartened and don't give up. Actually, the more you try, the chances of conceiving is higher. We have seen patients, yes.
Okay. So the last question is from Siti. She asked, "Hi, Dr. Pandian. What is ERA test?" Actually, Dr. Pandian mentioned it, but you can reiterate it quickly. She asked, "What is ERA test, and is it necessary to take it before transfer of the embryo?"
Okay, we have just explained earlier. ERA test is endometrial receptivity analysis. It's something. It's an optional test. It's not a must. So normally, what we do, we prepare the endometrium so that it becomes thick enough to to transfer the embryo. So before we transfer the embryo, let's say today we are planning to transfer the embryo. So we don't do the transfer, but we take a biopsy. That means we take a small tissue from the uterus, then we send it to the lab. Then from the lab, we will know whether this is the correct day. Today is the correct day to be transferred. That means
Mm,
whether your uterus or endometrium is ready to accept. Sometimes when we do genetic testing and get the correct embryo, the healthy, genetically good embryo, but still we fail. Still we fail. So you must understand that these are foreign bodies. This baby or this embryo is done outside. It's a foreign body. So when we put it inside the uterus, there's a lot of micromolecular changes occurs before the embryo gets implanted. So just because you've done a genetic testing and just we are just improving the chances. It is not 100% somebody is going to get pregnant. But however, we have come up from 20, 30% until now almost 60, 70, 80% of success rate. That's really good. It's really good. Yeah. If you ask
yeah.
me, ERA is a must. Well, it's of course every test and every procedure in IVF, it comes with a cost. So, but it's up to your doctor and you have to decide. But if you ask me, yes, it is good to do in order to improve the implantation rate or success rate.
Okay. So, sorry, Dr. Pandian, just one last
Yeah,
question. This is an easy one.
sure,
How many times should
no
a
problem.
person try IUI treatment before going for IVF?
Okay,
Any rule of thumb here?
many of them, many many of them, they think that IUI is a very it's going to yield very high success rate. No, not at all. Because once we put the sperm inside, again, the nature takes its place. We really don't know what happens. We have no control at all. The sperm, whether the sperm travels, whether there's an ovulation, whether there's a fertilization, nobody knows. If it happens, it happens. So if you ask me how many times you should do, probably I will do only for 3 times, not more than 3 times. There are
Mm,
some centers they do
okay.
6 times. Well, can it's a different doctor's approach is different. But if you ask me, if you 3 times it doesn't happen, then it's very difficult. I think it's high time you save some money and go for
Right.
IVF with the high success rate.
Okay. Thanks a lot, Dr. Pandian. And to those of you who ask questions, I will be contacting you. So do check your inbox for a free consultation with Dr. Pandian. Thank you once again, Dr. Pandian, for joining us. You can follow his page or actually his fertility center, Ram Fertility Specialist. So please follow his page if you would like to follow him for advice or just find out more. And thanks, Dr. Pandian, for actually joining today's stream. It was very, very helpful for many of us, even myself. And congratulations once again on your first year anniversary for your clinic.
Thank you, Maisie. Thank you for this opportunity. So, to those who have attended and listened to our talk, feel free to drop by anytime. We have a WhatsApp number. You can communicate with us in our social media or even our clinic. So feel free, and we are ready to answer any of your doubts or questions. Yeah, and
Thank
thanks for
you
the
so
opportunity
much.
again.
Thanks, Dr.
Good day.
Pandian, and thank you all
Thank
for
you.
tuning in. The next time I'll see all of you will be sometime nearing International Women's Day in March. So stay tuned, and thank you all for joining us. Stay safe. Have a good day,
Thank you,
everyone.
Maisie.
Bye. Thanks, Dr.
Bye bye, everyone.
Pandian.